Life is a casino. We don't think, we just hit them off with C-notes. And you can bet it all. I'ma be the last one standing tall. Joey Merlino.
What's up, G?
Life is a casino. We don't think, we just hit them off with
Tell us about ourselves.
And you can bet it all. I'ma be the last one standing tall. Joey
Skinny
Merlino.
with Joey Merlino.
Welcome back to this Skinny with Joey Merlino and Little Snuff. Today we're located at the Podcast Junkie Studio in Boca Raton, Florida. We have two special guests on the podcast today. Dr. Padula and Anna is here, and today we're going to talk about stem cells and exosoma, right? Did I say it right?
Exosomes.
There you go, exosomes.
Fuck, you can't say that word.
No, I can't say that. I mean, you got a 6th grade education over here, so it's a little hard.
Yeah, you got to work with him now. He's special ed.
Well, before we get started, this right here that we're going to talk about today seems to be the most popular thing that's been going on. Am I right to say that?
It's very popular.
Okay. How do you feel about it right now? Is it popular? Is you see more people doing it?
Absolutely. I started in 2008 in this industry, and I was training the original doctors, pioneers, since then on those technologies. And this year especially has been so dynamic.
Okay.
I was with a friend of mine a couple months ago. He went to Dominican Republic, Colombia to get it because you couldn't get it here in the United States because Biden, he fucked that up. And they charge you like $30,000. It works. The guy had a shoulder and an elbow. It grows the tendon back like it.
Yeah.
And he felt great. But you ain't got to go to Colombia. You come right here. It's in Florida. DeSantis passed it. You can get all you want.
And I feel like stem cells been on the news every day, and it's definitely very popular on social media. I see it all the time. How's the process work of it?
Well, it's a natural process where you take cells that have been grown and they will replicate whatever area of the body that you inject them to. So if you have a problem with a tendon or even muscle or a joint, when you inject these stem cells into that area, and there's other cells that we use as well, it will grow that tissue back. And that's the amazing thing. It works with your own body to heal.
To heal.
Dr. Padula has been my family doctor for 20 years. Villanova grad, my homeboy from Philly.
Yeah.
Yeah, he's a great doctor.
Thank you.
My whole family.
Thank
My
you.
whole family. It's why he got me living. I'm 64. Smoke 3 packs a day. I'm still in shape.
Still in shape. Still in
How
shape.
great he looks.
Yeah.
That's amazing.
So what does the process look like for you? For how does your process start?
The process of getting into this industry.
Yes.
Well, since I was 12 years old, I had a dream of living in America. I come from Poland.
Poland.
And myself and my twin sister, we always wanted to live here. We came to the United States for the students exchange in 2006. 90 days later, I was talking to a gentleman at the airport in Atlanta, and he offered me a job. Again, it was 2006, and he said, I own a stem cell and PRP manufacturing company. And I was like, what's that?
Yeah.
I thought it was just the word that I didn't know because they were not teaching us in Poland. But later on, I've learned nobody really knew what PRP and stem cells were in 2006. So as a teenager, I started working in the PRP and stem cell world. And I was working alongside with a lot of pioneers in this industry, such as Dr. Padula, for almost 2 decades. And, I was just making sure I was learning as much as I could, day and night studying whatever was available in terms of data, so I could be flawless in delivering the messages to people like Dr. Padula and other doctors from all over the world in terms of those technologies.
It's beautiful. God bless you.
Yeah.
Yeah, look, she came from Poland with nothing.
Yeah.
My American dream,
Yeah.
PRP and stem
Yeah.
cells,
God bless you.
Amazing.
gave me my American dream.
What's the risk and the rewards for stem cells?
Well, like any injection, the biggest risk would be infection, that kind of thing. But these are sterile products, so it's very minimal risk. You're not going to get things like rejection or much allergy, things like that. So it's a very, very safe process.
Perfect.
You got to get your hair done, Snuff.
If it's any thicker, I mean, we got a problem here.
You got to get something done.
I wouldn't talk so much about my hair. Somebody called you last night a bad name. I don't want to say
I'm
it.
64. What the fuck
Your
you talking
godson.
about? Yeah.
How about what he said? How many years of experience have you been doing this? And I know you touched a little bit on that.
Two
But
decades.
Two decades?
I was a teenager when I started in this business, and PRP and stem cells gave me my American dream, and same to my sisters. So
Did you ever try it on yourself?
long
Did you ever try it?
Absolutely. Yes, I drink PRP shots for breakfast.
Really?
PRP shots? I'm gonna start drinking that with Scotch.
Yeah. Yeah.
Scotch and PRP.
And stem cell smoothies for lunch.
Really? They got all that? Yeah.
Yeah, we could open a bar maybe. And
Yeah.
do that.
No, I gotta do it. I'm gonna drink one of them today.
The first time I ever heard about stem cells, I heard the Kardashians talking about it. So I'd never heard about it until really they kind of put it in the next level. I guess because maybe I'm younger, I don't know, or I don't pay attention.
Really?
Yeah, that was the first time I ever heard of talking about it.
Actually, Kardashians started posting things about stem cells just recently. I saw a couple of posts from Kylie and Kim recently. And it's interesting because stem cells have been around for such a long time.
Yeah.
But based on that, as we know, the regulations on the state levels are relaxing. The government is just letting the rail relax a little bit. And I based on my, based on my experience, because of that, more and more patients have access to information. But for us, as long as the companies that our physicians work with are, safe, compliant. They have a lot of data and literature on the products. The right patient with the right condition is being injected. We're golden.
Yeah.
I'll tell you one thing that works. A friend of mine's wife, she was losing her hair. When girls get older, their hair falls out. Yeah. I mean, I say I got daughters, they put your hair all over. She went and got it done. Looks like she got a wig on.
I just want to thank everybody for coming today. This really means a lot to all of us. It's a beautiful thing to just see all this, and I'm a big believer in trying to be a staple of the community, and there's a lot of people here today that have been leading examples of that. If you could aspire to continue to give and do things with love first, you're always going to turn out to be successful. When this ribbon's cut, we got the best Philadelphia cheesesteak and hot honey wings inside. Compliments of Skinny Joey's Cheesesteaks, our good brother and friend Joseph Perry, a.k.a. Little Snuff, biggest podcast out there, The Skinny. If you don't know, get on it, and you'll see Automotive Avenues in their next commercial. God bless everybody.
It works.
Her hair
well.
grew, like her real hair grew. And she was like thinning. Like, it's a shame. She's only in her 40s. She got her hair,
Wow.
her hair looks unreal.
And it's a very easy process. It's not like you have to go for a hair transplant,
Right.
which can be really a big procedure, and there's a very long recovery time.
Yeah.
People don't realize that. They go to these places and they get these hair transplants, millions and millions of hair
Yeah.
units,
Yeah.
and it hurts,
Yeah.
and
Yeah.
it takes a long time to recover, and this is a very simple process.
Yeah, she got it done. Her hair looks unbelievable. Looks like she got extensions and she don't.
What's the recovery time with stem cells if you do go get a tendon fix or something like that? What is the recovery time?
I mean, it's a day or two. You get
wow.
your shot, you're a little sore, and you cannot take anti-inflammatories like ibuprofen or naproxen, but you can use Tylenol and things like that for the small amount of discomfort that it causes. But it's really just like getting an injection, so there's not a lot of pain or discomfort involved.
It's
And I
amazing.
think as long as the patient is properly diagnosed by pioneers like Dr. Padula, he has a lot of experience doing this. So proper diagnosis, proper protocol, having safe and effective product that's compliant. That's all it takes for the patients to benefit from those products.
But like anything else, you have to have pure and well-manufactured product. If you don't have the right product, then you're not going to be able to do well with it. It's like, anything else. If you inject the medication that's inferior, it's not going to work well.
Yeah.
Well, years ago, they used to take it your own, right? You take your blood out of your hip and then inject your own blood back in you.
Yeah, we still do that
Yeah.
under surgical conditions.
Right.
Like sometimes if a patient has certain reason not to get exogenous stem cells, or, insurance doesn't cover it.
Yeah.
So we'll take it from their hip and then we'll spin it down. But this is, when you get a product, an exogenous product, like something that has been maximized, like you'll get the most number of stem cells you can get, then you'll usually get a better result. I would prefer to get something from a company like Anna than to take it from your own hip, because number one, it depends on your own health.
Right.
People that are producing their own stem cells, they may not be producing them at a level where we can, concentrate them.
Right.
But we still do it.
Right. Yeah, you got to go that your way.
It's a much
No, it's yeah.
better way to do it. Yeah.
And you're the provider for all this, correct?
Yes, all roads lead through Anna and evolution.
Good.
Okay.
We can't wait to Snuff. You got to do it next week.
Well, I really want to know a little bit about that and the peptides, though. It seems like the peptides, everybody talks about this now every single day. How do you feel about the peptides?
So peptides are small chains of amino acids that support the healing. And I'm not a doctor, but I'm giving you an opinion based from the angle of sales and business and what I'm seeing trending. I saw my first physicians using peptides as early as like 2014, the pioneers. And, watching my physicians do those, utilize peptides as part of their treatments, what I've learned is peptides have their own place in the region of medicine. Do we need to learn more about them? Absolutely. Based on being in this industry for 20 years, I've noticed that products just go through 3 stages. The first stage is, wow, it's God sent. I love it. It works like a miracle. And I feel this is where the peptides are today. But we're still lacking information in terms of like side effects or like more literature. But like everybody loves it the way people were loving PRP, from like 2010 to 2015, early pioneers like Padula were using PRP at that time. So the second stage is like, oh my goodness, like I'm scared of it a little bit. And the third stage of those kind of products, like PRP in the past, is for those products to become the standard protocol. So I think the peptides are in the category of like, wow, it's God sent. Will it work? Will they work for everybody? No. Are we seeing the peptides being helpful? Absolutely. I'm sure you've heard about BPC 157 or NAD+.
Yeah, everybody talks about that.
Everybody talks
That's
about
peptide?
it.
Yeah, NAD+.
Absolutely. It's a peptide. So does it work great? Yes. But does it work great on everyone? We don't know yet. Yeah. We need more studies like the PRP has so we could determine it. But my doctors are loving it, and I cannot wait to see what else is going to come out in terms of research and studies on PubMed in regard to the peptides.
Yeah. The PRP is the way to go. Mm-hmm. I mean, that's the real deal.
PRP is actually now starting to be approved by Medicare.
Welcome back to The Skinny with Joey Merlino and Little Snuff. This episode is brought to you by Pets First Urgent Care. With over 50% of Americans having a pet at home, Pet First Urgent Care in Langhorne, Pennsylvania is there for you. Open 7 days a week, 8 a.m. till 8 p.m. You could call the phone number, walk-ins only. They're there to help you and your family. I'm telling you right now, they care for you. They care for your pet. Every single patient that they see there with their pet, they take individual care of each animal. I'm telling you right now, make sure you check out Pet First Urgent Care, Langhorne, Pennsylvania. Call now or walk-ins only. 7 days a week, 8 a.m. till 8 p.m.
Oh, is it?
Yeah, and so it's a long process. These peptides, there's not a lot of money in it for the drug companies.
Right.
So there's never going to be like a huge study that says this is what these do. So we're having to work on, incidental reports.
Right.
You give it to somebody and they tell you, "Hey, I feel great." But there's not a huge study out there that
Right.
says, okay, this is what you use it for, this is what you can't use it for. So we're going by our relationship with the patients that
Right.
are using it.
Right.
What can you treat exactly with stem cells so people know exactly what they're looking for?
And that's a tricky question because it does not have FDA approval for a lot of
Okay.
uses that we still use it for, because there's something called off-label use of products. So I generally tell people that we use it to help your body to heal itself.
To support the body.
Correct.
Okay.
And it's a very old medical principle that, first do no harm, right? We say primum non nocere. And we know that we're not going to hurt people by using these products. So I generally tell people, if you have an injury and that injury is not healing, a lot of people play pickleball now, right?
Yeah.
And they're like our best customers. Everybody gets hurt playing pickleball, right? So people that want to get back on the court quickly, people that have injuries that are just not getting better, none of us have patience.
Right.
Well, we have patience, but none of us has patience.
Yeah.
And if we have somebody who's just not healing, like you come in and you say, "Hey, I hurt myself playing pickleball and I want to get back on the court," or "It's just not getting better. I try," and there, a lot of people not really trying. They go back out and do whatever, golf, pickleball, whatever they're playing. So they keep re-injuring themselves. So what we use a lot of, like PRP and stem cells, is for people that want to get better in a natural way more quickly.
Yeah.
And
Or
there's
if
so
they're
many
not getting
studies
better.
about it too, like on PubMed.com. Like it's a very
Listen, I did my elbow. You can
prestigious-
see it here. I got a bump from golfing. It was killed. Remember, I went in there. I was like, I couldn't golf. I couldn't move it.
Dr. Alan Mishra.
He did it.
Fine.
Hitting
Yeah,
the
it's
ball,
crazy.
hitting the ball like a champ.
Yeah. Hit it like Tiger.
Yeah, that's
Seriously,
right.
I couldn't move my elbow. I couldn't. It killed
Absolutely,
me.
yeah.
The bone still sticks out, but it works.
A lot of athletes have to be getting involved in this now because, as a baseball player, you're playing 162 games a year. You want to get back on the field faster than going to get a major surgery. Like you said, this recovery time could be 2 days.
That's right.
Yeah.
I mean, you do have to rest and let your body heal, of course, but it does really accelerate the healing process. And these guys, even back to when Kobe Bryant was playing, those guys were going down to Mexico,
Mexico.
to Colombia, and they were getting these treatments, and they were paying like nothing a regular person could
Right.
afford. Now, you could get it here. You could finance it. You have care credit. You have,
And it's cheaper here.
It is cheaper.
You ain't got to get on a plane, go to Mexico, Colombia, Dominican. It's a lot cheaper. My friend,
and
he went
safer and
safer. Yeah, you might get kidnapped. Snuff, we should send you there.
No, I don't need to get kidnapped. And if anybody does want to get in touch, and I'm going to put the phone number at the bottom of the screen. I'm going to say it also, 561-561-STEM. It's easy to remember. Call any questions. They'll be able to provide you the answers, and you could go from there. There is another thing I wanted to talk about.
The
the
veins.
the
your wife
veins.
got it done.
My
Dr. Padula did it.
My wife, when she came to you to get her, what would you call
The
it?
veins.
Varicose vein?
What was it?
What's it called?
Varicose vein.
Varicose vein.
That's another thing everybody's got. Nobody knows.
Well, she struggled with it for years. She was embarrassed to go out to the pool. She was embarrassed to go on the beach. She was embarrassed to wear shorts. After she went to go see Dr. Padula, everything was perfect.
She looks like a supermodel.
she does. Now it seems like
It works. Believe me, it works.
yeah, and she loved it. So the process was easy and fast. So if you want to just touch on that for a second too.
Sure. We do what we call endovenous laser treatments, and we put a small IV into the vein, and then through that IV we thread a laser. The laser's like one filament. It's fits through a very small IV, and it takes about 10 minutes.
Yeah.
And we close the veins from the inside. And what that does, people don't realize the veins that you see, the ones that kind of look ugly, and we close the deeper ones, and that closes off the ones that we don't like, the ones that look
look weird,
blue, or the ones that the ladies think, oh my God, I can't even go outside with this. And it's a great process. Insurance does actually cover that. Because it can lead to other medical problems. It can lead to swelling in your feet. It can lead to skin changes, ulcers of your skin.
I want you to go over with everybody the process of the intake, because that's the most important part.
Right.
So how does the intake work? First off, they have to call or they
call
email?
in the office.
Okay.
They'll get transferred over to me because I do the intakes. It's technically considered like the intake specialist.
Okay.
So usually right away they'll call in and be like, Desiree, this is what happened, and I fell, and I listen to them, but there's a spiel that we'll go through. And I get their name, their phone number, because God forbid if we get disconnected.
Yeah.
And then I need to know where they work. Unfortunately, I also need the address. A lot of people don't know where they work.
Yeah.
Because there's sister companies and stuff like that. So I need to know exactly where you work. Definitely need a copy of your paycheck, because that's going to give me the full name of your business.
Exactly.
And then we'll go down date of injury, what happened that day for you to get hurt, process of what then occurred. Did you go to the urgent care?
Yeah.
Did you go to an ER? An ambulance comes, something like that.
Yeah.
And which is most important, you have to report it. A lot of people think I have to go right to the hospital. You do need to let your supervisor know, because there's things that they need to do on their end.
They have to document everything.
Yeah, they have to contact their workers' comp insurance, because that's huge, that's important. Because then we want our client to have that information to then go with their doctors, because you don't want to pay out of pocket.
Yeah.
You don't want to use your personal insurance. There is a separate insurance that a lot of people don't know.
So you have to be on top of that kind of stuff. And the great thing is that the insurance companies realize that it can lead to
Other things,
medical conditions that will really be a problem later on.
They said 8 out of 10 people have it, don't even know it.
They don't even know it.
He checked me one day. He said, you got it.
Yeah.
Fuck, I got it. I can't even see a vein in my leg.
Yeah.
No, you got it.
So if you've had more than one pregnancy, there's a 95% chance that you have what we call venous insufficiency, meaning the veins are not bringing the blood back to the heart properly, and that is an actual medical condition that can lead to a lot of problems.
It's crazy. It really is. Where could everybody find information at from you? Do you have social media outlets, an email address maybe you want to say to our followers who don't know?
Yes, we do. We have an Instagram page, Avalution, Avaloution, Avalution. Facebook as well, same one, same website, avalution.com.
And if anybody has any questions, they can reach out to you and you'll walk them through this process.
Absolutely.
Sounds good.
I'm telling you, go get fixed up.
Yeah.
You need it. Snuff, you got to go. We got to send you.
What else do I need? I think my hair looks pretty good today, so
Your
maybe I
hair's
should
good. Your
get
hair-
involved a little bit. But I definitely want to try it out. And anybody that can reach out, we're going to have the phone number listed right here. Dr. Padula's your guy. He's going to be able to take care of everything. He did it for my wife, so I'm sure he could do it
Hey,
for
Don,
you.
let me ask you what. Don't they have an intravenous too? You could do like a drip.
Yeah, and that is a great addition to the direct injection, because it gives you a general wellness.
Right.
So, and the other thing that I want to bring up, it's a little touchy subject, but for guys that are having a little bit of problem, with
Right.
their wives or girlfriends and being able to perform sexually, we do great stem cell injections and treatment for that as well.
We got a lot of guys there.
Yeah, I'm sure we have a lot of male audience. I'm sure that they wanted to hear that. So
Yeah.
Just get it done. Get it done
works
anyway.
wonders.
What the fuck's the difference?
yeah, you heard it here first. The Skinny with Joey Merlino and Little Snuff.
Thank
See
you,
you
guys.
next time.
Life is a casino. We don't think, we just hit 'em off with C-notes. And you can bet it all. I'ma be the last one standing tall. Joey Merlino.
What's up, DG?
Life is a casino. We don't think, we just hit 'em off with
Tell us about
C-notes.
ourselves.
And you can bet it all. I'ma be the last one standing tall. Joey
Skinny
Merlino.
with Joey Merlino.